Hello, my name is Dr. Polly Niravath, and I'm a breast oncologist at Houston Methodist Neal Cancer Center. I'm going to talk to you today about everything you ever wanted to know about breast cancer. I'm going to talk to you today about breast cancer that has metastasized to the brain. Now, obviously, for every breast cancer patient, this is a very scary topic. The idea that the breast cancer can move to the brain can frankly sometimes be terrifying. However, I will say that our treatment of brain metastases has improved significantly over the past many years. First, I'm going to talk about the different types of breast cancer and their different behaviors. So, for example, estrogen-positive breast cancer is a type of breast cancer that rarely goes to the brain. When it does move to the brain, it's typically one of the last sites of metastases, meaning more commonly, people who have estrogen-positive breast cancer may have already had liver, lung, or bone metastases before it may move to the brain. On the other hand, women with triple-negative and HER2-positive breast cancer do have a slightly higher chance of the cancer moving to the brain, and it tends to move to the brain earlier on in the course. However, the treatment options for everyone with brain metastases have improved significantly. One of the treatments we've been using for many years is radiation therapy, but radiation therapy has moved leaps and bounds in the previous decades. So for example, we now, instead of using whole brain radiation therapy, which used to be a very toxic treatment and many times would leave women so cognitively impaired that they may not be able to return to work. Actually, for the most part, whole brain radiation has largely been replaced by more focused types of radiation, like stereotactic radiotherapy or gamma knife radiotherapy, which are using very, very focused beams of radiation that are only focusing on the parts of the brain that are affected by cancer, and thereby sparing all the healthy brain around it. This type of treatment is really night and day difference from whole brain radiation therapy. For example, people who receive stereotactic radiation or gamma knife radiation often are just getting treatment for a couple of days, and they're ready to go back to work or go back to their normal functioning within just a few days. And they have very little long-term side effect from this. The medications for breast cancer that's moved to the brain have also improved significantly, especially for those ladies with HER2-positive breast cancer. We are constantly discovering more of these HER2-targeted therapies that we can give that actually move into the brain very effectively. They're able to cross what we call the blood-brain barrier, meaning that these medications can actually get into the brain and treat the brain metastases very effectively, unlike some of our older medications. For example, there's a pill called tucatinib, which is combined with other medications. And when used in HER2-positive brain metastases, it's so effective at treating the brain metastases that many times patients with small brain mets will not even need to have radiation in many cases. Similarly, there's another medication called Enhertu, or trastuzumab deruxtecan, which is also very effective at crossing into the brain. So for those ladies also, they may be able to receive just the Enhertu, which would treat their systemic disease as well as their brain metastases, and they may not even have to have radiation in some cases. This has really been a huge paradigm shift for us because people used to always receive local therapy, meaning either surgery or radiation for brain metastases, but now for many HER2-positive cancer patients, we don't even have to do radiation for many of them with brain metastases. For patients who have triple-negative breast cancer, we also have some medications which are very effective at crossing the blood-brain barrier. Specifically, there's an oral chemotherapy pill called capecitabine. This can be used by itself or sometimes in combination with other chemotherapies, and it's very good at treating the cancer in the entire body as well as specifically in the central nervous system or in the brain. And of course, patients who have triple-negative breast cancer also have all those options of focused radiation therapy, such as stereotactic radiation or gamma knife radiotherapy available to them as well. So as you can see, we've come a long way in terms of breast cancer brain metastases. We've moved to many therapies that are far more focused, more effective, and less toxic. These treatments are generally allowing people to live longer and ideally preserve as much quality of life for as long as possible.